Where's Bo? Bo's in the bedroom. Okay, there's Bear. Hello. There's Sweet Potato, the angel bear. What do I want to talk about? I want to talk about the fact that I was watching a Seder on Zoom and someone was posting things on Facebook and I saw it and I hit the roof and got really angry and raised my blood pressure. And first of all, what did they do? They have COVID. They had a positive test and then they were still positive on day 7 because they got a rapid test and sent me a picture of the result. It's like, if you're going to be acting like this, don't give people the proof of what you're doing. But I spike my blood pressure. COVID's not the only thing that can kill people. Having a heart attack or stroke because you're reacting to how irresponsible people are being can also kill people. I have friends who have parents that died from COVID. My friend's father died from COVID at OHSU after getting one of the experimental treatments that Trump got when they thought he was getting better, and he still died. So I have another friend who has MS and now has COVID. So yes, but reacting and getting, so first of all, what do I want to tell you? Right now, assume that everyone has COVID because Omicron is highly contagious and there are people that are not being irresponsible in terms of having. First of all, my friend thought she could go to a pharmacy to pick up prescriptions if she is COVID positive. That is false. If there's a lockdown, you are allowed to go to a pharmacy and pick up your medications. If you're supposed to be in isolation, no, you're not supposed to be going to a pharmacy to pick up your medications. Stay the fuck home. And if you think you're pregnant and want Plan B is sold over the counter with no prescription. Send someone else to get it or get it delivered. Do not walk into a pharmacy when you have COVID and risk the lives of every person you come into contact with. And what kind of mask was she wearing? I don't know. But I'm talking about the reason I put the codependent hashtag is when you're negatively affected by someone else's behavior. She's in Arizona. There's no way I'm going to get COVID from her. But she also blocked me on Facebook again. And this time she's not getting unblocked. I think she already blocked me 3 times before and she has multiple accounts. So she can probably see my social media. But you know what? If you don't like what I have to say and you block me, and this is one of the people that's done this over and over. And when her mother died, I added her back. But you know what? Not this time. When she sends me a friend request, I am not adding her back. And I told her she's not being added back. And they block you so you can't reply. And then they reply and you can't see what they said. Could I see what she said later if I look? Maybe. But I can't see it right now because I'm blocked. But blocking me doesn't mean I can't see some things. But what did she... Okay, so she said to me, like, I've already covered the part that no, you're not allowed to go to a pharmacy to pick up your own medications when you're positive. But the thing is, people need to understand that with the current Omicron spread and with the people that are asymptomatic and may not even know they have COVID, and I'm not looking directly at the phone because I'm getting a migraine trigger. And yes, I need to take my blood pressure medicine because spiking my own blood pressure by reacting to this is not healthy for me. Derailing my day based on what other people are doing. You know, I know a lot about this. And what I would tell all of you is you need to assume that people have COVID, whether they have it and they know it and they are being irresponsible or whether they don't know it. And with this 5-day, they're saying that people that test positive after 5 days can go back out there if they wear a mask, even if they tested positive without testing out of isolation if their symptoms are less. Which means that there's probably a lot of people walking around that you could be exposed to, and they're not like... They're saying that after, like on day 5, if you test positive on a rapid test, you should isolate for another 5 days. But you don't have to take a rapid test, which means if you think you're feeling better, you can go out after 5 days, even if you're still contagious, which is probably why patients that are in hospitals right now, the numbers are going way up of patients that don't have COVID then when they go in there and they get COVID when in the hospital. Because there's healthcare workers that are working that are COVID positive that are going back to work after day 5 and are spreading it to other patients. So right now, I would not go anywhere near a hospital if you don't have to. I would not go near an urgent care. I don't even know that I want to get on public transit, but I have a P100 respirator. And no, I'm not allowed in the hospital with it because it's an unfiltered, meaning it protects me and not you. And even if I put a surgical mask over it, you're not allowed to walk in the hospital with that. But I bet you, first of all, most people are not as educated as I am. And if I got on a bus like that, would anyone tell me to get off or put, like, probably not. But I know that, like, what I would do is put a surgical mask over the unfiltered exhale port. And if I do that, it's probably like more protection than most people have right now, both for me and for you. I'm not going to put an N95 mask over a P100 respirator, but I will put a surgical mask over it. And then I could overreact and say, oh, I need to take a COVID test. I have one rapid test left. Let's take it. No, I do not have COVID. I have other symptoms today, like being too tired to put water in the humidifier for the machine for sleep apnea and having it set on 1. That can cause you to have more like congestion. So, by the way, if you don't know, if you're in the US, the 4 rapid tests you can order from the government, the site that's supposed to go live today, tomorrow is already live today. Although there were some issues with, like, you can have 4 per household. Even if you have 6 people in your household, you still only get 4 tests. But some places, it was the system was glitching and saying, oh, you live in an apartment building. Someone in that apartment building already got one, and they weren't letting them order. So that's something they have to fix. Or multi-unit, like multi-unit, like at the same address. And also, Medicare is not paying for the rapid tests. I mean, any tests, like for you to take home. Although they said that if you go to your like a health center that there's places that are giving out rapid tests for people to take home. But if you have Medicare and you don't have an Advantage plan, no, you're not getting reimbursed from your insurance. There's 2 separate things. Anyone in the US can order 4 tests to be delivered to your address in 7 to 10 days. But they only have a certain amount right now. So once they run out, people are going to have to wait to get their 4 tests. But if you have Medicare, you cannot be reimbursed for over-the-counter tests that you buy. If you have an Advantage plan like I do, they will cover 4 tests a month. Apparently, the pharmacist can prescribe them, meaning you don't need a doctor's prescription. You can get them from the pharmacist and they can bill it to your Medicare Advantage plan, or at least mine, 4 a month. If you have private insurance, you can get reimbursed for 8 a month. In addition to the 4 from the government, you can get one time free. And they're saying that there's places like Medicare funded clinics or community clinics that are giving out rapid tests for people to take home. But why should someone on Medicare have to go to one of those clinics to get tests to take home? Why can't they get tests covered by Medicare? You know, I can only fight with so many people a day. But I would like to ask President Biden why Medicare is not reimbursing for over-the-counter tests for people. So I order my 4 tests. I have 1 test here right now, and I can get 4 covered a month if I go into a pharmacy and ask the pharmacist for them. So now there's 7 people watching. So what am I doing wrong? I have to stop reacting to everyone because what my friend did was irresponsible. She is wrong about being able to go in and pick up your prescriptions when you're COVID positive. And but there are probably a lot of people walking around, and the only difference is that they don't know that they are positive, or They didn't take a rapid test after day 5 and they just went back out there. What you need to do to protect yourself is don't go anywhere right now that you don't absolutely have to. And get an N95 or a KN95 mask. Or there's another one that's like a 94. But you have to be careful that you're not getting counterfeit masks. If you can't get those masks, take a surgical mask. I'm using my surgical mask for my allergies right now. No, I don't think I'm going to get COVID sitting here. And no, Woof Woof never had to take any tests because Woof Woof was not exposed to COVID. And even though there's animals that have gotten COVID, I'm not worried about Woof Woof. Okay. So, no, not sweet potato or bear or Bo either. Okay. If you don't have an N95 mask, take a surgical mask and put a cloth mask over it. It will make it fit better. If you have an N95 mask, I would take an extra precaution and put a surgical mask over the N95. There's been very few times during the pandemic I've gone anywhere without doing that. And I haven't heard anything lately about the glasses or goggles. I try to have on like my migraine glasses that are bigger that go over these glasses. They're not goggles, they don't seal. But the P100 respirator does seal, and you can tell because you can't smell things, and my glasses don't fog up. But again, I'm not allowed to walk into a hospital with that. So, because it's unfiltered. And I even had the supervisor come out and said if I put a surgical mask over it, and they said no. All right. So, I have got to stop letting people derail me but what they're doing. You need to assume that you are going to. They said that right now, basically everyone is going to come into contact with Omicron. Does that mean everyone's going to get COVID? Not necessarily, but pretty much everyone's going to come into contact with Omicron. And I need to get a booster. But one thing I'm afraid of getting Omicron if I get on a bus to go and get a booster. I'm afraid of having symptoms like I did after the second shot if I have something that's really important that needs to be done. I would rather stay here by myself and not be exposed to anyone than take a risk of being exposed to Omicron, although I did have 2 people come in to help me last week, so I was home alone for 668 days. And that number stops because people did come in on Monday and Tuesday. And yes, they wore masks, and I was afraid to even take off my P100 respirator and eat something in my own apartment after that. And where is my HEPA filter for my filter? Like, I bought the filters, I can't find them, so they don't do me much good if I can't find them. So I either have to find my HEPA filters or buy more. So what am I supposed to be doing and what am I doing? Well, I'm talking to all of you and telling you that you should just assume that people have COVID right now, whether or not they know it or they don't, whether or not they know what the isolation rules are or they don't, because what's the difference between a person that tests after 5 days and tests negative and goes back out there, or doesn't test at all and goes back out there when they still could be positive? So I feel it right here in my chest. That's where I hold stress. So Woof Woof's always calm, and he's happy that I'm not using bad language on my broadcast today. But and I was supposed to test the studio and see if it would work. And apparently, if I I'm going to share it to Twitter. The other Twitter is live streaming, but it won't live stream to my main Twitter. So I'm going to share it. Social sharing, Twitter. Let me share. Can you still hear me when I'm sharing it? I'm putting Omicron discussion. If anyone's watching the replay, like right now when I'm talking and I'm typing this, can you hear me or not? All right. I did find out that it's not like the previous haps. You cannot join your broadcast. I can't go on the studio and join the same broadcast. I can start a second broadcast. And if this crashes, I can't rejoin this broadcast. So, and Instagram only works for certain people that were picked to test it. But why I can't live stream to Twitter from here, Was I blocked by Twitter for live streaming? I don't have any idea, because I can share it to Twitter, but I can't live stream to my main Twitter, which is Harvard Journal and the number 2. But I can live stream to Harvard Journal. And I thought the skating started at 2:00 in the morning my time, but it doesn't start until Thursday, not Tuesday. And I thought the person put it online wrong, but they didn't. I got it wrong. So I have 12 people watching. If anyone wants to comment, but yes, the person that blocked me on Facebook after their behavior and then commented where I couldn't even read what they wrote, this time when they asked to be added back, no, they're not getting added back this time. 5% of the people cause 95% of the problems, and this is one of the people that has done this over and over, and not this time. I'm not playing anymore. So, and yes, I got dizzy again today, and there's things I'm supposed to be working on. And is there a replay of the Seder to watch the part that I missed when I got really upset? I don't know. But I do need to get a booster. I do need to get a flu shot. And I have an appointment for a booster, but I will try to get one sooner. But I have to find a way to get one without getting Omicron in the process, which means, like I said, probably like maybe if they have that clinic, I'm afraid to go to a clinic with not a clinic, but like where they have it set up for a lot of people. Like I don't want to go where there's a lot of people, but could I walk if they're having it again at the college? Could I walk there and not even take the bus? Probably. And are they having it again this week? Maybe. I think I think I could have gotten an appointment today at Safeway, but I knew I wouldn't be doing well enough to go, so I didn't take that appointment. So, and why did I cancel my last booster appointment? The one at my doctor's, I changed the appointment to virtual. And the one before that, I had a low-grade fever. And since the vaccine gives me a low-grade fever and I don't want to take any ibuprofen to affect my antibodies building properly, I canceled that appointment. So, since now there's 12 people, but nobody's commenting, I don't know if 12 people are watching or 12 people stopped in for a second and left. But either way, I'm supposed to be taking better care of myself and not reacting to every person in the world. And my advice to you is there may be people walking around with Omicron that don't even know they have it, and they're not being blatantly ignoring the rules. They may not even know. They may be asymptomatic and not even feel sick. Just assume that everyone has COVID and be really careful. What is this? Newburgh recall election. And my vision's getting blurry again. One of the things on my list was to fix the lighting. What does this Newburgh recall election say? Where they keep fighting with the superintendent. Decision to recall Newburgh School Board Vice Board Chair and Chair. All right. So if anyone's watching the replay and you have anything to say, you can type it in the chat. So what am I supposed to be doing now? Other than fixing the lighting, maybe watch an episode of General Hospital, because I missed the ones I don't think I watched any of the ones from 2 weeks ago last week. So, because New Year's Eve, 2 weeks later would be, New Year's Eve, 14th. But I didn't watch an episode yesterday. So from the 17th. All right. So just try to be safe out there. Okay. I'll check on my friend who has COVID and check on my other friend that has COVID and try to watch an episode of General Hospital and calm the fuck down. Sorry, woof woof. Yes, I used bad language in my broadcast. All right. So Now I'm getting chills. All right. And I'm going to check my temperature again. It was 99.1 earlier today, but no, I don't think I have COVID. I just think I need to manage this stress better. Okay? All right. Woof woof, do you want goodbye? To say goodbye. Goodbye. All right. That's why I keep woof woof around.